AdmissionCare has been very helpful with the relationship, particularly with the emergency room and the admitting provider. That justification is there, and seeing those data points clearly outlined gives us a better feeling and more comfort with admitting the patient to the hospital. Even if they only meet observation criteria, it improves our relationship. Much fewer denials on the back end, causes less stress or less friction. And so the physicians were happy, and the APPs who had to use the service were happy because they weren't getting those pages and calls later on in the day from advisory services asking them to either upgrade or downgrade because they were appropriately placed in their status. Where observation rates are extremely high, once you really start digging, you will typically find that a lot of those patients could have been flipped to inpatient, but that's just what they're used to, or maybe they don't want to worry about the denials, or maybe they're not quite sure about the documentation. And so AdmissionCare really helps with that documentation part of it. So making sure you are capturing the right components of diagnosis that you may not necessarily appreciate that actually meet inpatient criteria. And I find it to be invaluable for that. I think it can be used everywhere. Having AdmissionCare integrated into the EHR I find to be very essential. It makes it very seamless when you have to put in criteria, particularly within those first 12 to 24 hours. And then all of that documentation is put into the chart. So it even further supports your diagnosis and why you want to move them to inpatient status. It helps the hospital. It helps the patient by having less of an observation cost, which can sometimes be 20% of their bill. It helps you find the nuances of how to get the patient there. Providers trust it because you're pulling, again, data. It's not just you're speculating on why you think the patient should be there and using your own internal justification.